Now, patients at the Savelugu Government Hospital in the northern region are being turned away because the hospital shut down its services from today following a surge in COVID-19 cases in communities and among medical staff there. JoyNews sources there say there has been a surge in the cases in the municipality, adjoining districts as well, which depend on the hospital for healthcare and among staff of the hospital. Some text messages that went round to the public by the hospital officials said that the shutdown will last for at least 2 weeks, during which time disinfection exercises will be undertaken to break the chain of infection. Some of the patients who visited the hospital today have been speaking to us.
My daughter is sick. When we came, they told us they are not working because of COVID. My next step is to take the child to a pharmacy so they can get her some drugs. I heard the facility has been locked because of COVID. We had no option, so we decided to come because it's a child, thinking they might have pity on us. But when we got here, they said no, they won't attend to us. We have nowhere else to go because this is the only facility we have known.
Those are some people who went to the hospital today and had to be turned away. Martina Bugri is our correspondent in the northern region. She's joining me right now. Martina, what is the latest? First of all, I know that you've been talking to some authorities at the hospital. What do they say? Martina? A hard time for me there with Martina Bugri. It's like, well, there she is. Martina, do tell us what the director has been telling you.
What she says is that what they are doing now is to attend to only emergency cases and maternity cases. And so if you come in and your case is critical, they would look at you, they would attend to you, and they would serve you. But any other case, it's advisable you don't even show up at the hospital because it doesn't make sense to come to the hospital with probably just malaria and end up going home with COVID, or you come in with just maybe a slight headache and you are going home with something bigger than that. And so the advice is that patients who are not so critically ill should just look elsewhere and don't even come to the Savelugu Hospital.
What is the situation at the moment? In the morning, I mean, you brought us stories about the other people who are coming with other health complications and had to be turned away. What is the situation at the moment? Have people now understood that they don't need to come there, or are people still coming and being stranded?
People keep coming and then they have to be explained to. But when they explain to them, they understand that it is something that you need to look elsewhere, because people are beginning to understand that COVID is real and is biting. Now, someone said he traveled from one of the communities to the place, and then he was told that they have to look elsewhere. And he says that, well, he understands because he knows that if not for COVID, anytime he came in with any problem, he was attended to. And so if they are telling him today that he needs to go elsewhere, he knows it's a serious matter.
Finally, Martina, are there any other hospitals that provide alternatives to people in the areas that usually rely on this hospital?
Savelugu Hospital is like a major hospital because it's one of the municipalities. And so what they probably will be doing now is to come to Tamale Teaching Hospital or the Tamale Regional Hospital or the West Hospital. These are the options available. And that means that traveling probably between 20 and 2 hours to Tamale for treatment.
Martina, thank you very much. Martina Bugri there. So if you live in that area, Savelugu Government Hospital has been closed down. They're only taking care of emergency cases at the moment because they're trying to slow down on infection rates among medical staff there.